So welcome to the MamasteFit Podcast. In this episode, we're going to be talking all about Diastasis Recti or diastasis.
What do you say?
I say diastasis.
Yeah,
what do you
too.
say? Yeah,
Diastasis.
I've heard people say it in other different ways. There is a lot of fear involved with this normal thinning and spreading of the abdominal muscles known as diastasis. And so in this episode, we're going to break down some hot takes in addition to how can we approach healing diastasis in the postpartum? Do you have to even approach it? Like, could it just heal spontaneously? Like, does it need to heal? And so we're going to break this down all in this episode and go way beyond like the standard Instagram post of how to heal your diastasis with these 5 exercises, because it's definitely so much more than that. Welcome to the MamasteFit Podcast. My name is Gina. I'm a perinatal fitness trainer and birth doula.
And I'm Roxanne, a certified nurse midwife.
And this is the MamasteFit Podcast, where we empower you on your pregnancy, birth, and postpartum journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and approach recovery after birth.
We share our personal experience navigating motherhood and our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum recovery.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast. Today I have Hayley Kava here, who is one of our in-house pelvic floor PTs. We have 3 of them in the gym now. And so one of the things about MamasteFit is we work really closely with other professionals to provide really collaborative care. And I learned a ton from Hayley. I hope that she learns a ton from me and Roxanne. And our kind of like mutual working together really enhances our ability to support our clients in so many different kind of facets of their life. And so today we're going to be breaking down diastasis. And this is something that Roxanne and I get tons of DMs about. Can I do your program? I have diastasis. Yes, you can do our program. Like, you don't have to not move your body just because you have diastasis. Or what exercises can I do during pregnancy to prevent it, to not have it at all? And so there's a lot of fear involved with it. We'll even have folks that are like several months postpartum that are like, I've been doing all of the ab exercises and I still have separation. And they're talking about like half a finger. Like, I can still put my finger between the muscles. Yes. And so there's definitely tons of fear involved with it. So we're going to break down what is it, what is normal versus when is it maybe not normal, and we need some more like deliberate approaches to it. And then also an out-of-the-box approach to diastasis, because it's more than just do crunches or do side bends or breathe or do this one set of exercises. How you do them. Yeah, just deep core exercises. There's a big approach that we can do for it. And we're also going to accompany this episode with a workout video that includes some exercises that you can do with our approach to it, because it's more than just do squats and crunches and this. How we do them can also impact how we heal. So Hayley, let's start with what is diastasis?
All right. So diastasis in Latin, I think, means separation or like pulling apart. So you can have diastasis of any number of muscles in your body. And so diastasis rectus abdominis, DRA, is the separation of the connection of the 2 rectus abdominal muscles, which is the 6-pack. So the one that goes from like your ribs down to your pelvis. Again, 6-pack muscles. And in the middle of those 2 6-pack muscles is connective tissue. So like fascia, or, there's just something that holds those 2 muscles together. And then we have other layers of abdominal muscles. So we have our internal obliques, our external obliques, and our transversus abdominis, which you don't need to remember, there's no test, but they all come together behind that rectus or around that rectus abdominis, and they build up this like line in the middle where they all come together. So this rectus abdominis meets up at the linea alba, which is the technical term for that line, and it's adaptable and it's stretchable. And in pregnancy, actually, this can happen to people who are not pregnant. So if you've ever seen like this an ultimate dad bod that's like with like a big distended Santa belly, like those folks probably have diastasis. If you asked them to like crunch up, you might see some coning. So this isn't necessarily exclusive to pregnancy. It's just very common in pregnancy that as uterus is growing, as baby is growing, it's putting pressure out on the entire abdominal wall. We're seeing changes of the rib cage and we're seeing changes of the pelvis, which is going to influence tension along that midline. And we can get stretching or thinning of that linea alba because that tissue is pretty dense and thick. In order to, again, make room for a baby, it has to stretch and thin, and this is good. And I think that's really important to reinforce, is that in order for your baby to grow well into that third trimester, we're going to have some separation of that midline.
And I think it's a normal adaptation that happens during pregnancy. And so we'll get folks that'll DM us, how do I avoid or prevent diastasis? And we're like, it's actually a normal adaptation that needs to happen during pregnancy. We can be mindful of like how we move so that we're not like overly stretching it or overly damaging it. But ultimately, if you cone here and there, it's probably not that big of a deal at all.
And I think there's a lot of different terminology and language when it comes to diastasis recti abdominis, or DRA, is coning, doming, loafing, hard coning, soft coning. And I think the thing that people think of when they're pregnant is like, again, when you sit up and you see this like little bulge in the middle of your abs that looks kind of crazy, immediately we start to freak. And I don't think we need to freak that hard. I think it's just a little yellow flag that's waving, that's going, are we adapting to the changes that are happening in our body well, or are we maybe compensating a little bit? Does that mean that you're splitting down the middle? Like aliens gonna rip out of your belly? No.
Hopefully not.
Hopefully not. But likely no.
But some of the terminology that we've been hearing is there's a separation, your abs are splitting. I've seen videos where people take scissors and they're like cutting like fabric abs and ripping them apart to demonstrate this separation that's happening. And the muscles, there is no like ripping that is happening. Like everything is still connected. It's just thinning and stretching.
And I think it's also important to remember that, yes, like where this measurement happens, or where like a soft point in the abdominal wall is stretching, is where it's obvious is at the midline. But it's like all of the muscles, so all of those deeper core muscles, they are also lengthening and stretching. And so there is stretch through the whole thing, not just
the center. Mm-hmm. So some of the common things that we'll get from people is, I was laying down, which lounging during pregnancy has tons of stigma, or if you slouch, you'll have a C-section, is like one quote that I heard that I was like absolutely appalled by. And so then you have people that are afraid to like sit down and relax, and then they'll see some sort of like what appears to be coning when they lay down. And so for those folks, I usually tell them, like, there's a difference between coning that's occurring, which is essentially that pushing out of the center of the abdomen from increased pressure internally that's pushing out on it, versus this is just how your belly relaxes when you're in a restorative position. And for me, if it's just you're just lounging, it's really not that big of a deal. And even if you see coning from exertion and it happens every once in a while, that's also not really that big of a deal. Because we'll also get folks that are like, I was doing an inversion, so like a forward-leaning inversion to help release the lower uterine ligaments, and I saw coning. And I'm like, well, in that one, it's really just how your belly is relaxing. It's not really a huge deal. It would be different if you were like in a handstand push-up where you're like upside down and you have a lot of core activation. Like that type of kind of coning may be from pressure, potentially.
Yeah. And so you can, if you like are rolling or you're doing maybe not in a forward-leaning inversion, be safe, but like if you're sitting up and you see some of that sort of pushing out of the middle, you can touch it. And I feel like a good test is like, if I touch it, does it feel soft? So that would get labeled as like soft coning, versus if I touch it, is it like rock hard? And so it just tells us about how much pressure force is behind that movement. So it's soft. It means like, yeah, there's some pressure there, but it's not like so much tension that it's like putting the tissues on stretch. Whereas if it's a hard cone, like if you were in a handstand push-up or like doing something max effort and you touched it, it would be firm. And I don't think that we have like definitive research to support that. That's just a theory that kind of in the rehab world, we kind of are like, okay, there's some yellow flags, there's some, red flags that we would want to maybe avoid more of that, like super hard, like, and continuous loading. Because I think even if you were to hard cone doing something difficult one time, that's not comparable to the amount of force on your abs if you were like just from being pregnant.
Yeah,
right.
Absolutely. And we have a whole YouTube video where I break down like different exercises and common ones that can cause more of that hard coning and modifications that we'll link down in the notes below. So we're not going to talk in depth on like how to modify your exercises during pregnancy to like limit or avoid like hard coning with movement, but there are ways that we could modify our workouts so that we're more comfortable when we're working out. Because coning can sometimes be kind of painful. It's almost kind of like stretching, like pressure sensation to the front. That's usually pretty uncomfortable. And so we're big fans here of making sure that you guys feel good during your pregnancies. I think it's reasonable to feel good. And so minimizing coning with like exercise can make you more comfortable in addition to potentially decrease like the severity of a diastasis in the postpartum. So if you want like specific exercise modifications, if you're noticing coning with like overhead press, pull-ups, core exercises, head to the notes below and we have like a whole video where I show you how to modify movements that commonly cause coning for us. So let's talk about like postpartum like healing with diastasis, because that's really when most people are like really thinking about it a lot. Like, what do I do? How do I prevent this? How do I heal it? Can I even exercise? Can I do anything until it's healed? So let's kind of talk about the nuance of what it's like to heal postpartum. Because I think like I saw one study like years ago that said most people heal just kind of spontaneously in the first like 6 weeks. Like their body is just kind of like wherever it was supposed to go, just kind of goes there on its own, but not for everybody.
Why? Not fair.
Not for everybody, but
not fair.
I don't know exactly what causes it for some people versus others, because we have people that are like exercising throughout their pregnancies that maintain a diastasis, people that are not as into exercise during pregnancy that don't maintain one. And so I guess let's talk about kind of like the spectrum of postpartum.
I'd say, I hate to pile on this community because they struggle with a lot already. Our more hypermobile community, so people who have who have hypermobility, period, or connective tissue concerns, their body is going to respond to stretch differently than someone who maybe doesn't. Yeah, genetically, you just might be lucky or not lucky. And I think, I'd say hypermobility is like a big factor that people who tend to be hypermobile are going to be your highest sort of risk category for something becoming a little bit more difficult to rehab. Not impossible. It's just we want to be more mindful than those that aren't.
Yeah, so even for Roxanne and I, we have the same parents. We are biological sisters. I don't maintain a diastasis. Like, I think by the time I hit my like all clear point, like quotations, like it is normal looking, even though I'll look at my videos from when I filmed like the postpartum program, like early post or like the first like few months postpartum, and I'm like, I look like I'm postpartum, and that's okay. But for Roxanne, she usually maintains the diastasis for like years. So she's had kind of the same separation from her first pregnancy into now. We're both sisters. I think she does my programming.
I think the whiplash on being postpartum in diastasis is so hard because you like love your belly and it's like people are talking about it and you love it so much, and then all of a sudden it's like, all right, you better be gone, right? Like, and then to put on that like, oh, I have it's not gone, like it's not gone, I have a belly, like I'm over a year postpartum now, is like, we want to put a label on it that says, oh yeah, I have Diastasis Recti, and that's why I don't have a flat stomach, right?
Yeah.
And I think there's a lot wrapped up into the body image of that, and I think that's complicated. But I think for people who are seeking support with that, that's also valid. It's also valid to want to look a certain way. It's also valid to want your abs to function a certain way. But I think the reason why there's so much interest in searching or Googling what's going on is sort of wrapped up in that, like, wanting to look a certain.
Yeah. And so even though, like, my abs decided to be closer together than Roxanne's, I think both of our cores are functionally the same. Like,
right.
We both have
That's
the same pelvic floor issues or not pelvic floor issues. Like, we both suffer from constipation. And so even though, like, our, like, abdominal wall looks differently, both Roxanne and I have the same type of function. And I think that's something that is really important to, like, know as well, kind of from your initial hot take to the episode, is the separation or the spreading or the thinning, whatever language feels best for someone to describe it, does not equate to function or to problems either. Mm-hmm. And so, like, our stomachs look different, and it doesn't mean that, like, my body is better or works better than Roxanne's or anybody else's. And so I think we could take away some of that pressure to have the muscles, like, right next to each other or somehow, like, melded together right. to a single sheet of muscle, because one, that's not realistic, and two, it doesn't equate to function either.
Yeah. So there was a study that looked at, again, the reference, I have no clue. It's just pulling from the back of my brain. But they looked at comparing, like, diastasis and prolapse. And what they kind of concluded from the study was that diastasis was actually protective of a prolapse diagnosis. So women who had more significant diastasis tended to have less prolapse. I think from a pressure standpoint, that makes sense.
Yeah.
So if there's a change in pressure in pregnancy and in postpartum, and if you were, like, the way you managed that pressure was to increase stretch on the ab wall, and so you had more significant pressure going outwards, you probably had less pressure going downwards. Whereas if your ab wall did not, like, release some of that pressure the same way, well, if we're blocking off the front, there might be more additional pressure down.
Which makes total sense.
And so, like, from my own body, I feel like after my first, I really hadn't, like, postpartum, virtually no diastasis, but had significant prolapse symptoms. And then it kind of flipped, where it was like, oh, prolapse symptoms are good. Now, with second pregnancy and third pregnancy, that, like, the ab wall has been kind of the thing that's taken a little bit longer to get functionally better. But the pelvic floor and prolapse symptoms were good. So that's my N of one sort of experience with that. But I think that's an interesting sort of pressure take on how the two things interact.
Which makes tons of sense. So for some of the folks that I have, like, very limited experience, because I don't specifically work with, like, diagnosing or, like, helping people heal from diastasis in a one-on-one standpoint. It's really only from, like, our postpartum programs, and that's more just kind of, like, general postpartum approach. The folks that I've seen that have, like, more severe diastasis seem to be, like, higher level athletes, and I almost wonder if it's because, not that, like, lifting weights equals tighter pelvic floor, but I'm sure there's a little bit more of a correlation to maybe, like, a little bit tighter or, like, a little bit more tension within the pelvic floor, that pressure has to go somewhere. And so maybe that could be contributing towards more severe diastasis. This is not to say that athletes have equals anything, but just some of the patterns that I've noticed. And so it would make total sense if you have a little bit more tension within your pelvic floor where it doesn't move when you breathe. It's got to go somewhere, and vice versa as well.
Yeah, and we see that there isn't a huge correlation between diastasis in back pain or diastasis in hip pain or diastasis and function. And so I think it is important to remember, like, hey, that number on the measurement, doesn't mean you can't do XYZ, because there are plenty of cases where people have either a more significant diastasis or a relatively small or non-existent and can still have functional issues. So we gotta look at the big picture.
Yeah. So what are kind of the approaches that you may have with somebody that comes to you and they want support with their diastasis, regardless of the severity or like the gap, or what are some like approaches that you normally take to help them feel like good about their body and functionally improve whatever issues they may be dealing with?
Yeah, I think if the reason someone's coming in is specifically for diastasis concerns, then we want to address those concerns. And that's something that I work on as a PT, because my perspective is like, well, we want the whole thing to work together better. So sometimes I have a tendency to be like, we'll worry about the abs as they come, as it all comes together. But I think as I've matured as a therapist, I go, oh, this is this thing that's really important to you. I want to make sure that you understand how we're looping this in together with the big picture. So number one, with any muscle, when rehabbing any muscle in the body, we want to think about where that muscle starts and where that muscle ends, and then the function of the role of that muscle. What does that muscle do? The action, right? So origin, insertion, action. When it comes to our core muscles, the origin, right, is up on the rib cage, and it actually is not just in the front. So the rectus abdominis is just in the middle, but the rest of our abs attach all along our rib cage, even into the back. And then the insertion is all the way down on the pelvis, so like on your hip bones, all the way across the pelvis. And then they connect in the midline. And then the action of our rectus, or our six-pack muscles, is like helps our core flex. But our internal obliques, our external obliques, and our transversus abdominis are all muscles of respiration, right? They also help with flexion of the core and side bending of the core. But their major role is to oppose the diaphragm to help us breathe better. So we better start with breathing, right? Yeah. We better start to teach these muscles how to do their job well in order to improve their function. And so we want to look at, like, how are we breathing? What strategies are we breathing? If we're in person, get hands-on on that individual and get a sense of how well do those ribs move, right? We know the rib cage changes in pregnancy. Most people go up a couple bra sizes just from width of the rib cage changing. So that's going to change how we breathe. It's going to change how the origin of those core muscles functions, and then it's going to change how well the diaphragm is able to move up and down, period. Again, then we want to look at that from the top down, and then we want to look at the pelvis and how the orientation of our pelvis has changed throughout pregnancy. Again, normal changes that happen in order to be able to carry a baby in there. But again, some people snaps back postpartum, and some people it doesn't. And I'd say most people it doesn't. And so we want to understand that distal attachment, so where those ab muscles attach on the bottom, and how are we able to move and control that from the bottom. Then we want to be able to put them together so that now the top and the bottom can interact in all the ways that they might need to interact via flexion, extension, side bending, and rotation, all the different angles, all the different ways. Because those layers of muscle work at different angles, they all are going to have times where they're working better and more efficiently than others. So we can't just isolate. Like, one of my biggest frustrations with diastasis rehab is like all the focus on just transversus abdominis only, and like isolating the TA. It's like, that's one of 4 muscles. Yeah. And the tightening, the tensing of that muscle is just one action that muscle can do. That muscle needs to be able to tighten, right? So if we think about that like an isometric hold, right? You need to be able to hold it still, but you also need to be able to shorten it. You also need to be able to lengthen it and then rotate it and use it in multiple directions. And so if we're stuck in isolation land, or we're struggling to isolate, I think I see that a lot. It's like, I'm laying on the table, I'm having a hard time feeling those TA muscles contract. Well, no wonder. Because if we're not looking at where does that muscle start, where does that muscle end, and that's off, you're going to struggle. It's going to be frustrating to like lay there on the ground and try to get those muscles to contract.
Yeah.
So maybe to bring it back around, where I'd start is addressing what's going on above, what's going on below, and then let the abs do what abs do, which is just function.
Yeah. So it sounds like rib cage positioning, pelvic positioning, paying attention to what the pattern is before we approach exercises. Like what position does someone like to be in all the time? Do they have a little bit more flared ribs? Maybe pelvis is a little tilted a bit more, which is probably normal. And just in general.
I would even back up and say like another kind of like the hot take is like, does rib flare matter?
I don't know. Does it?
Because when you start looking at like ab walls of people who have had kids and who haven't had kids, it's not like these rib flares just like magically pop out of nowhere. Often these are changes in the structure of someone's body that have existed since they were.
I feel like I have always had like a left-sided rib flare, and I've always had
Absolutely.
like whenever I did like a yoga class, it was always so much easier to go into more externally rotated positions on my left versus my right.
Does that mean that you're not going to be able to rehab your ab wall?
Yeah, like
do you have to fix your rib flare before your abs will work better? No.
Yeah, because our diaphragm is not the same on both sides. So why would my rib cage look exactly the same on both sides as well?
Do we want to keep these things in mind? Sure. Does that but I think a lot of times those types of that type of terminology, fix your rib flare, fix your diastasis, it like puts the brakes on recovery, puts the brakes on just doing exercise in general. Because we're like, I can't do any core work until I fix that left rib flare. Let me pull up my Instagram page and find a post that gives me 3 things that was like, come on.
I also, when I was first getting into this space back in 2017, like rib flare was definitely a huge thing. And I was like hyper focused on my form with like my lifts. Like I wanted my squats to be like perfection, and it ended up kind of holding me back because I like could not accept like any deviation from perfect form. Because if I didn't do perfect form, I was hurting myself. It was like kind of like the messaging that I was telling myself, even though I accepted imperfections in other people. I was like, no, I need to have perfect form. And I ended up essentially just not lifting as heavy as I needed to, and was like physically holding myself back because I needed this to look this very specific way. Like, I'm having some rib flare. Like I can't do that exercise until I fix that rib flare because I'm going to hurt myself if I don't. And now, like, I have a different approach to things, but I think, like, that kind of feeling creates a lot of fear of, like, I cannot do X, Y, or Z until I fix this problem. But is it actually a problem? Like, is having some sort of gap in your abdominal wall a problem? Is having a rib flare a problem? Like,
and if you're having pain, or you're having pressure, or you're not able to do the things you want to do, then we can talk about it. But I think it's like, don't think we get just so far into our head about our body in a time period where we're already concerned about our body and how it looks.
Yeah. So for the things that have helped me in my past few postpartums to feel comfortable. Postpartum is hard. It's a little uncomfortable just in general. There's a lot going on.
Right.
I found breathing into my backside, like doing back expansion breathing. Even now, like if I'm having like lower back pain or discomfort from like carrying my kids all day, like back expansion breathing helps me feel so much better. Like if I'm having SI joint pain, if I'm having any pubic pain, if I'm having lower back pain, just breathing into the backside of my body is like a game changer for me. Either standing, all fours, like curled up in a little ball, like smushing stuff, like as I like squeeze and round, was like super helpful early postpartum for me.
And that's helping us with orientation of the thorax and the pelvis. That's helping us with approximating, ab muscles that have been elongated throughout pregnancy. Like that is also huge for nervous system regulation. So the expansion of our back body helps us turn into parasympathetics, helps us relax, which I think is a huge part of postpartum recovery, equally as important as like bringing our abs together.
Yeah,
Right.
Absolutely. I also found thoracic mobility to be really helpful for feeling good within my body. I think it's very helpful if you were looking to approach healing diastasis, if you need to even heal it postpartum, like having a rib cage that can move, that isn't just stuck in one position, which I think is really easy to happen. Like we're holding this cute little baby and we're just kind of feeding them, and then you get like nap trapped and you're like, well, I'll just hang out here and play on my phone. And then you're like, oh, my back hurts. So adding in the thoracic mobility was something that I found really helpful to help me feel good in my body. And when I feel good in my body, it's easier to then do exercises and movements to help strengthen my body postpartum. And then I was incorporating a lot of like, well, not a lot in early postpartum, but more of like the hip shifts and kind of like groin releases as it felt better for me to kind of like separate my legs a little bit more. I know there's like some fear with like spreading your legs after you give birth, especially if you had any sort of like tearing, just to add a little bit of like pelvic mobility. And so looking at the rib cage, looking at the pelvis, and then rounding were all things that helped me to feel much better within my body. And then once I was like outside of that first 6 weeks postpartum, and I wanted to start loading the tissue again, that's when I really felt like my core was like really reconnecting to itself. Was, okay, now I've kind of done like the deep core connection with like the breathing and the gentle mobility. Now let's add on some extra stuff. Like, can I keep my core in its position as my arms and legs do stuff for that core stabilization? Okay, I could do that. Now let's add some like a band. Let's add some resistance with weights, and then to get off the floor. So like we can do all of like the deep core exercises on the floor in perfect positions and like maintain and then add all the load. But eventually we need to get on our feet because that's where we live life. We don't live life on the floor.
Yeah, just like with the pelvic floor, right?
Yeah.
We can start to activate those muscles. We can respect the position, and then eventually we gotta put it to work. And in those more functional movements, we're not thinking about squeezing it all the time. Like we're not thinking about, okay, all right, transversus abdominis.
Yeah.
Come on. Some in the early phases, sure, we might bring some more consciousness in there. But if we're doing that right, you don't have to think about it.
Yeah.
When you're working out. And I think that's a big shift for a lot of my clients. Is like, I don't really want you thinking that hard about your abs when you're squatting. I just want you to squat. I don't want you to think that hard about your pelvic floor when you're doing this thing. I just want you to do it.
Yeah, it's mentally fatiguing too, to like constantly be thinking about it. And so for us in our programming, it's like the core warm up that we do, which is all floor based. I want you to really think about like breathing and being like more simple with your movements then. And then once we've kind of like connected, okay, well now let's stand up and do our movements. And that kind of integration should hopefully still kind of be lingering.
Kind of prime the system so that neurologically.
So it's like hopefully still there for you when you come upright to do your squat, to do your step up, to where like we're still thinking about positioning and breathing. And then by the end of the program, it shouldn't be something that you have to think about quite as much anymore because it becomes a little bit more like automatic, which is the goal. But it can be really mentally fatiguing to think about every single rep, every single breath, every single activation. And then it feels defeating because you're like, oh my God, I've done like 4 reps and I'm exhausted.
I can't.
It's like, oh God. But yeah, no. So for me, I found back body breathing, just mobility at first and like the early postpartum was like really helpful for me in just healing and feeling good, quotations, because early postpartum is hard to feel like amazing. And then once I kind of came out of that early postpartum, it was like, all right, well, now let's add some loading to it. I'm going to start on the floor to prime the system, to connect with my core, to think about my breath. How do I maintain stabilization? Starting to add some load. So over the weeks, we add bands and weights and things to make it a little bit more challenging on the floor. But then after we get from the floor, it's not like, okay, 6 weeks from now, we'll do a squat. Like, it's like, no, we're going to be on the floor, we activate, and then we're going to stand up in the same workout. Like, we're going to get upright, because it would be a disservice to only do these deep core exercises on the floor and never at some point come, okay, well, how do we take what we've learned there to this upright position so that we can integrate and heal postpartum?
Right, use it. Yeah, absolutely.
I think there's also a lot of folks that are afraid to advance their exercises if they have a diastasis. But I think there's a lot of research, or limited research, because there's probably not a ton of research on this stuff, that loading the tissue can actually help to heal somebody if they are plateauing in their healing.
Yeah, a big one I feel like that comes up a lot is like the fear of ever doing like a plank, the fear of ever doing a sit-up. And so especially in those cases, I get those people doing like rolling sit-ups to like, do the thing that scared you the most, with some buildup, but like, and see that you literally, you're not, nothing's going to pop open.
Yeah.
You're not going to explode. It actually felt really good. And then keep going.
Yeah. We'll get a lot of questions where folks are like, how do I know that I'm ready to do
try it.
The next movement? How do I know I'm ready to advance? And that's usually what I say. I'm like, just try it and see how it feels. And if it doesn't feel good, regress a little bit. But that's really the only way that you're going to find out, can I do this next movement, is to try it and see how it feels for you. And if it feels good, then advance it again. And if it doesn't, just come back a little bit. And so I think there's a lot of power in understanding that a lot of the answers that we're seeking are already within ourselves. And this applies to birth as well, because we'll have folks that are like, how do I know what labor position to do? And I'm like, try some and see which one feels best for you. And the one that feels best is the best position. And it's okay if it's not the one that like mechanically opens the pelvis the most based on where baby is. If it feels best for you, that's a good position to be in. And I think this also applies when it comes to like approaching fitness or movement in the postpartum, is if you're trying to figure out like what is like safe for you to do with whichever diagnosis that you have, try it.
Yeah, there's very few activities, like unless you're swinging a knife around,
Yeah.
it's probably safe. Like if you're like, hey, Hayley, I really want to swing these knives around while I do this exercise, that's probably the only time I'd say,
Yeah, I would say
is
that's
this
probably
safe?
If there's like a really big fall risk, like if we're gonna, I've seen these like crazy videos.
If you're balancing on like an exercise ball on a concrete floor or something.
Yeah, doing a barbell squat. Like that's probably a bad idea. That's probably a dangerous exercise.
Depending on your skill level, it may be perfectly safe. So like, yeah, like the term like safety, or am I allowed, or is this safe? It's like, again, it is very unlikely that the movement that you can do with your body is going to harm you at all.
Yeah.
Again, unless you're going to face plant into the floor. But so it's like, yeah, try it. Right. And I think though sometimes that's like what pelvic floor therapy is good for, is like to have someone be able to stand next to you as you try the thing that you're afraid to try and be like, see, it worked. That was amazing. Great job. And there's nothing, I mean, that's one of my favorite things to do. It makes my job easy. But so often people's experience in rehab is the opposite of that. And that pisses me off. When they're like, oh, I can't do that. I can't do that. I'm like, did you try it in the office? Did you try it in the office and it was clear that you were coning or you had a lot of pain when you did that? Oh no, I didn't try it. In the office, they just told me because I still have a 3-finger diastasis, I can't do that. It's like,
Yeah, so it's not like the patient that's like, I can't do that because I have this. It's someone else told them in some capacity that it was like unsafe for them to do this exercise because the type of gap that they have, which is super irritating. Like we'll get folks that are like, I really want to get back into running, but I still have a diastasis. And I'm like, why couldn't you run? Are you like
right, are you
leaking a ton? Are you having tons of pain when you run? Like what's going on that like is impacting your ability to run? It's like, oh, well, I just have this diagnosis. And I'm like, oh, well, that by itself doesn't mean that you can't. Like if you're like obviously in tons of pain when you're running, like it's really uncomfortable, you're like peeing yourself constantly, like, okay, well maybe we need to find a different cardio activity while we do exercises to help strengthen yourself to get back to running. But just having a 3-finger separation doesn't mean you can never run again until it's not, because it could just be your normal for you. Like Roxanne still has like a few finger separation. I mean, right now she just gave birth, so she probably has
Roxanne,
get back, bounce back, Roxanne. But like she maintains separation.
Right.
But can still run and do all of the things.
Years ago. It was probably 6 or 7 years ago when you guys were at the other spot. We did like a class, a diastasis class. I don't know if you remember this, like a long time ago.
Yeah.
And I brought with me one of the students that I had at the clinic. She just wanted to like come and watch the workshop that we did. And she had never had any kids before. It was like this petite little gymnast or something. And I was like, and everyone's sort of like feeling and like trying to figure out if they have diastasis or not. And everyone's like kind of stressed out. I was like, oh gosh, this is not the way I wanted this to go.
This is the opposite.
This is also like early in like me figuring out this. And I was like, hold on, everyone come over here. This is a person's body who, with her permission, who's never had a kid. Let's all start poking in her abdomen. And she had like a 2.5 finger wide separation with like probably an inch or at least an inch depth. No problem. That was her normal. That was her baseline. And so it's like, oh, I wish like everyone before they even got pregnant could have a baseline, because then you wouldn't be so stressed out about it.
Yeah.
After, when like if she had never checked it before, had a baby and was like, oh, I have a 2 finger separation and it's 1 inch deep, this means I have diastasis. Well, actually you had that before.
So this is just normal for you now.
You actually are perfect.
Yeah.
And it's like if we don't have that, we don't know.
Yeah.
Yeah.
So diastasis, there's definitely a lot of fear involved with it. We get folks during pregnancy that are like, how do I prevent it? Should I never do core exercises? I should never just move my body because I don't want to make it worse. And then in the postpartum, it's kind of the similar sentiment of like, I don't want to move because I don't want to make this worse. I don't want to cone a single time because then my core will explode. And I think it's important to note that diastasis is not just the spreading by itself is not pathological. Like it's not like a problem always. There may be other things going on that can be impacting function, but it by itself is not really a huge deal unless there's like other things going on.
Yeah. Yeah, absolutely.
And so there's different approaches that we can take if you're wanting to help bring the muscles closer together, if you want the tissue to be denser. Like we can start by thinking about what our positioning is of the rib cage and the pelvis, like breathing mechanics, which is a huge component of that whole abdominal canister. Like how are we responding to pressure changes within the abdomen, and that can positively or negatively impact different symptoms that we may be feeling. I typically find how well we can change positions plays a big role in our comfort. When we're kind of stuck in positions all the time, this could increase symptoms that we're feeling. How well we're breathing and kind of internally managing pressure plays a big role in how we feel. And then after all of that, like how well can we stand upright and transfer movement from upper to lower body? How well can our pelvis respond to our rib cage functionally up and down the chain? And then adding resistance and loading to that. Mm-hmm. We don't want anyone to be afraid to move their bodies during pregnancy or postpartum. There's a lot of like safe and unsafe list. If you have this, yes. If you don't, no, like list. And none of them take into a lot of the nuance into consideration, where it's like, if you have rib flare, never do this ever again, or only do these 4 exercises, like top 5 like exercises to heal, whatever. And all it does, I think, is really like scare people into moving their body when, if you're unsure, if you're ready to try something, try it. And if it feels good, then it's probably fine. And if it doesn't feel good, truly listen, because I'll get that a lot where folks are like, I feel like garbage when I run during my pregnancy. And I'm like, well, maybe don't run. Can we try a different sport?
Right.
And so explore the movement in your body and know that the best person that can tell you whether something is safe or unsafe, or not even safe or unsafe, but whether something feels good for you or not, is yourself, and explore and feel empowered to like move your own body during pregnancy and the postpartum, regardless of what diagnosis you may have been officially given or unofficially gave yourself. Mm-hmm. So
what do the Gen Zers do? They do this? Like,
is it like clapping?
Like this? Yeah. When you're clapping, like, yeah.
I think it's like, yeah, like I guess it's the opposite of the little violin.
Like preach. Like yes.
Absolutely. Well, thank you so much, Hayley, for being here. Do you have any last advice for somebody that may be listening and maybe they were hoping for like a list of exercises to do and they're like, well, now this feels more or less confusing for them. Do you have any advice for our listeners that may or may not be dealing with diastasis and this is something that they really are wanting to overcome or fix in some capacity?
I think it's like respect that it is a process, a healing process. Respect that 5 exercises on repeat is not going to fix the problem, and that you need to integrate. So your core needs to integrate within a system, and when that starts to happen, good things are gonna happen. And that would be my advice.
Awesome. Well, we do have a workout video or a video that we're going over different exercises and kind of applying a lot of these concepts to that is accompanying this podcast as well. So if you heard this one and you're like, cool, but what do I do?
Yeah.
Check out the workout video that we did together where Hayley is going to walk you through kind of different approaches to, well, how can we feel our core again? How can we manage breathing? And then how do we get it upright and functional again? So if you want more of like, okay, thanks for the why, tell me how, we'll break that down for you in the workout video from this week as well. So thanks so much for listening to this episode with us. If you want more support during your pregnancy or your postpartum, Hayley does offer a Pay What You Want pelvic balance class, which is a virtual class. I think you offer it like once a month.
Just about.
I think it's 8 classes.
It is 4 weeks, 2 classes a week, and they're 30 minutes each, so quick and easy, and it's all the foundational pieces, and we build on it each week.
Yeah, and so this pelvic balance class is great for pregnancy. You can do it postpartum, and it's really just teaching you how to feel stuff in your own body and to recognize things again. Because when you can understand your own patterns, it can really help you just feel so much better in your body. And Hayley offers it as a pay as much as you want class so that it's accessible to all, because we never want finances to be a reason why you can't seek the care that you need. And she is a pelvic floor physical therapist. She does offer like one-on-one virtual consults as well. But the pelvic balance series is a great way to work with Hayley if you're wanting to approach your pelvic health and just feeling good in your body in general, really any phase of life. I'd highly recommend it. I did it during my pregnancy. I did it once postpartum, and working with Hayley as closely as I do has been a huge impact on me. And so I would love everyone else to work with her as well. So we'll link it down in the notes below, depending on when you listen to this episode. Usually it's like the beginning of every month, but follow her on Instagram. She usually announces when the next one's coming. But it's usually like a 4-week series, and I would definitely check it out. So thanks so much for listening. If you like this episode and you'd like more episodes like this, be sure to subscribe to our channel so you get notified whenever we release new episodes. And if you want to check out any of MamasteFit's pre- or postnatal fitness programs, you can head to our website and use code STORY10 to get 10% off any of our online offerings.